Hey folks, welcome to the Friendly Neighborhood Oncologist. And I'd like to give a friendly shout out to everybody in the community who wants to immerse in the Oncoverse. If you're not part of that community yet, please consider subscribing. It's free. I'll never direct message you. Go ahead and smash that like button, as the millennials say, and help the Friendly Neighborhood Oncologist get into that algorithm. So I'm a board certified medical oncologist, and I practice in the suburbs of a major metropolitan city here in the United States. I practice not far away from a top medical school and a top academic cancer center where I trained. And on a daily basis, I help my patients kick cancer in the, you know what. For our patients, there's a lot of information and a lot of misinformation that's available online. So this channel is just simply about connecting people to resources that are free and that reflect what is a consensus standard of care for solid tumors and other cancers here in the United States. And as a reminder, I'm not your cancer doctor. Please consult your own board certified physician. Nothing that I say should be construed as a medical opinion or a diagnosis or a recommendation for staging or treatment. In my capacity as a YouTuber, I am not a medical or legal representative for any of these societies like the National Comprehensive Cancer Network Guidelines or the American Society of Clinical Oncology or New England Journal of Medicine. I'm simply reflecting standard of care medical resources. Okay, well, without further delay, let's get underway and immerse in the Oncoverse. So we're talking today about early stage EGFR mutated non-small cell lung cancer. So in some of our past talks, we've talked about that. Unfortunately, we have patients who present with advanced non-small cell lung cancer or early stage non-small cell lung cancer. And sometimes we're lucky to catch these patients in an earlier stage where they're potentially resectable and they've already had appropriate studies or pulmonary function tests, good tissue, sampling of mediastinal nodes, PET CT scan, brain MRI. We discussed a patient in tumor board with cardiothoracic surgery, pathology, radiology, and pulmonary doctors. And let's say the patient is operable and they're stable for surgical exploration, resection, and they have fully resected disease. So I think what we can get at is that there's a number of stages where adjuvant chemotherapy would be considered standard of care. And we're going to particularly pick out patients who have the EGFR exon 19 deletion or the exon 21 L858R substitution. And as we can see, for those patients, osimertinib after chemotherapy is considered the standard of care. So we're going to go to the New England article, which was known as the ADORA trial. As you can see here, this was published by Dr. Wu and colleagues in the New England Journal of Medicine in October of 2020. It's a randomized, double-blinded international clinical trial. And patients in the study at that time, with that version of the AJCC, they had stage 1B to stage 3A disease. They had fully resected EGFR mutation positive non-small cell lung cancer, specifically the two sub-mutations that we just mentioned, which are the two most common. And these patients were randomized 1-to-1. They were allowed to have adjuvant chemotherapy if indicated prior to treatment. And I think the big picture here is that in terms of overall survival, if we're looking at the overall population of the folks who are in the trial, you'll see that in terms of disease-free survival, it was much, much higher for the group that received osimertinib, which is also known as Tagrisso. And of course, that comes with its own side effects, an oral pill, a tyrosine kinase inhibitor. And I think the big picture is that the hazard ratio was 0.20, so an 80% relative benefit in terms of overall survival. And that the study was published when the survival data was still immature. So this is a big change in our standard of care, became FDA approved. Obviously, you see on the guidelines is recommended for improved overall survival benefit. So again, this is the Friendly Neighborhood Oncologist, and I'd like to thank everybody who tuned in, and I am out.